Gas exchange monitoring. Chapter 19. Transcutaneous monitoring is continuous and non-invasive. It uses Clark electrodes to monitor TCO2. And it uses severing os electrodes to monitor TCO2. Transcutaneous used more on infants due to their thin skin. It is usually placed on the chest or other flat surfaces except for over bone. The monitor heats the skin to increase an accurate reading and is decreased by thicker skin, anemia and changes in perfusion. The reading can also be affected by age. It is initially compared to a prior arterial blood gas draw. Due to the temperature increase, the probe should be moved at least every 4 hours. Oximetry measures hemoglobin saturation and uses spectrophotometry, which is the measure of light absorption. The 4 types of oximetry: hemoximetry, pulse oximetry, venous oximetry, and tissue oximetry. Hemoximetry uses an invasive blood sample. It monitors the hemoglobin and oxygen saturation. It can use 4 or more wavelengths of light to calculate reduced Hb, O2 Hb, carbon met Hb. It is often used to diagnose carbon monoxide poisoning, which is a Cahb of more than 20%. This is treated with a non-rebreather. The normal Cahb is 0 to 1% and in smokers it is 2 to 12%. Pulse oximetry is non-invasive. It measures Hb saturation and pulse. Uses spectrophotometry and photoplethysmography, which uses light to detect volume change in tissue during pulsed blood. It is referred to as the 5th vital sign. It is not recommended to be set lower than 92% because it can be off by plus or minus 4%. It is only for monitoring, not diagnosing. The pulse ox uses red and infrared light. The infrared absorbs more in oxygenated blood, whereas the red absorbs more into deoxygenated blood. This is all part of the Lambert-Beer law. The 6 main pulse oximetry uses are: during transport, during anesthesia, during sleep studies, while in ICU, for O2 therapy, and post-surgery. 7 pulse oximetry error causes are: motion artifact, which is the most common, dark skin, nail polish, lighting, CAT scan dye, cold hands, and hypotension. Some pulse oximetry pros and cons. Pros are: it is low cost, low maintenance, non-invasive and continuous. Cons are: it has no perfusion or hyperoxia indication and it can't assess ventilation. Pulse oximetry charting should include the date and time, the signal strength, where probe was placed in the reading, what position or activity patient was in, and any assisted breathing details. Venous oximetry is invasive. A catheter is inserted in the vena cava and pulmonary artery. A normal SpO2 is 60 to 80%. It is used mainly in ICU. Tissue oximetry assesses the adequacy of O2 delivery and circulation. It is now primarily used for research. It can be used for brain oxygenation and detecting cerebral ischemia, typically during surgery. It is placed on the forehead.